Euthanasia presents a profound conflict in Islam where religious teachings often clash with modern ethical dilemmas. Based on the article titled Physician-Assisted Suicide and Other Forms of Euthanasia in Islamic Spiritual Care by Nazila Iskandarova, this video explores the intricate balance between faith and contemporary moral challenges. According to the Canadian Medical Association, 2017, euthanasia is an intentional act beginning of the quotation that is explicitly intended to end another person's life, and that includes the following elements. The subject has an incurable illness, the agent knows about the person's condition, commits the act with the primary intention of ending the life of that person, and the act is undertaken with empathy and compassion and without personal gain. End of quotation. According to Islamic sources, Muhammad Ghali says that euthanasia is defined as ending an individual's life out of compassion for that person's suffering. Yusuf al-Qaradawi, a world-renowned Muslim jurist, also used to say that the purpose of euthanasia or mercy killing is to release an individual from suffering due to a terminal illness or an incurable condition through lethal injection or the suspension of extraordinary medical treatment. The approach-raisonnable of passer-seveni euthanasia is based on the Muslim legal tradition's approach to two states of life, the stable, mustaqar, and unstable, ghair mustaqar. Generally, Islamic law differentiates between passive and active euthanasia. Passive euthanasia, like withdrawing treatment, is more accepted, while active euthanasia remains controversial. When Muslim patients and families face these challenging questions, Islamic spiritual care can help people make decisions that may impact patients, family members, health caregivers, and the whole community by responding to questions such as: what is the Islamic view on death? What is the Islamic response to physician-assisted suicide and other forms of euthanasia? What are the religious and moral underpinnings of these responses in Islam? Historically, Islamic jurisprudence has grappled with the concept of euthanasia. While the Quran is silent on suicide except in Surah Al-Isra, verse 31, which says, "Do not kill your children for fear of poverty," or in verse number 33 that says, "Nor take life which God has made sacred, except for just cause." When addressing these challenges, Muslims heavily rely on the Quran that offers profound insights into life and death, emphasizing the sanctity of life. It portrays death as a transition, not an end, highlighting the soul's journey beyond the physical realm. Hadith literature firmly opposes it, shaping Muslim views on mercy killing and forming a strong opinion among Muslims. Classical and contemporary interpretations of the Hadith literature suggest a stern stance against suicide and mercy killing. These interpretations underscore the importance of faith and patience, even in the face of unbearable suffering. Islamic spiritual care also acknowledges that the problem with respect to physician-assisted suicide is not so simple as to derive any conclusions from theological or medical sources alone. Legal changes in Canada in 2016 have stirred debates within Muslim communities in Canada. These shifts challenge traditional views, prompting discussions on the role of Islamic theology, culture, Islamic ethics, and spiritual care. Islamic spiritual care plays a crucial role in addressing end-of-life issues. It integrates traditional Islamic sources with modern social sciences to offer holistic support to patients and families. Muslim spiritual caregivers guide individuals through complex decisions, balancing religious teachings with personal circumstances. Their role is pivotal in navigating the ethical landscape of euthanasia. Dignity, justice, and non-maleficence are core principles in Islamic spiritual care. These values guide caregivers in ensuring that patients' rights and well-being are prioritized. Autonomy and informed consent are vital in decision-making. Caregivers face ethical challenges, balancing respect for individual choices with adherence to Islamic teachings. Theological debates continue around active euthanasia, with Muslim scholars emphasizing the sanctity of life and the potential for abuse in vulnerable populations. In this respect, a renowned Muslim scholar, Abdulaziz Sashidina, invites us to consider this sensitivity in Islam. In 2011, he said, beginning of the quotation, "Any error of judgment in this regard could lead to a morally and legally questionable decision to end an individual's life by either acti-7 acquiescing in the patient's death or acti-7 causing it," end of quotation. As we see, physician-assisted suicide is still a contentious issue in Islam. The complexity of legal and moral considerations makes it a challenging topic for scholars and caregivers alike. The principle of least harm in Islam guides decision-making, urging a careful evaluation of options to minimize suffering while respecting religious values. Euthanasia decisions have profound social and emotional implications. Families and communities play a crucial role in supporting individuals through these challenging times. The broader impact on Islamic jurisprudence and societal norms is significant, prompting ongoing dialogue and reinterpretation of religious texts. Compassion is at the heart of Islamic spiritual care. Emphasizing empathy and understanding, caregivers strive to balance religious values with individual needs. Ongoing dialogue and reinterpretation of religious texts are essential. This approach fosters a balanced perspective that respects both tradition and modern ethical considerations. We've explored the complex interplay between Islamic teachings and modern ethical dilemmas surrounding euthanasia. By understanding these nuances, we can navigate these challenges with empathy and wisdom. By embracing compassionate care, we honor both religious values and individual dignity. This balanced approach ensures that we support those in need with respect and understanding. Let's continue this important conversation. Engage with your community, seek guidance from spiritual caregivers, and strive for compassionate care that respects both faith and individual needs.